About 100 students fell ill this week at that New York school where 8 of the suspected swine flu cases have been identified. NBC's Jeff Rawson is outside that school in the New York City borough of Queens tonight. Jeff, what can you tell us?
Lester, good evening. Parents continue to pull up to the school even just in the past couple of minutes trying to figure out what's happening with their children. This was something they thought until today that was isolated to Mexico, but here it is hitting home. We should mention 8 or 9 children, as Bob Bazell reported just a moment ago. Officials most likely believe they have this strain of the swine flu, but is not confirmed yet, and so the school has not made any decisions yet, Lester, about exactly whether to close or not on Monday. But the New York City Board of Health said late today that if these do become confirmed cases of the swine flu, they will urge this school and any others with confirmed cases to close down because this is transmitted person to person. Cleaning crews are here disinfecting the school right now, but parents, of course, are still concerned. Just a little background here. Just a few days ago, about 75 children who go to school here behind me felt ill. They felt those typical flu-like symptoms, dizziness, fatigue, nausea. So the CDC checked them out, and once again, 8 or 9 of them came back as most likely having this bizarre strain, Lester.
Jeff Rawson, thank you very much.
Richard Besser is the acting director for the Center for Disease Control and Prevention. Dr. Besser, thanks for being with us.
Thank you very much for having me.
We know that health officials so far has stopped short of calling this a pandemic, but what's your level of concern that this flu epidemic could turn into just that?
We are very worried about the situation taking place in Mexico and the potential for development into a pandemic. We are working very closely with the World Health Organization and will be participating in their expert meeting to look at the evidence to date and determine whether a change in the pandemic status is warranted.
Health officials have been planning for years for an influenza pandemic. What plan is in place here in the United States to at least try and curtail the spread of this deadly disease?
There's been extensive planning throughout the U.S. government, throughout states and localities, across businesses, in the event that a pandemic occurs. Regardless of whether this develops into a pandemic strain, there are steps being taken and aggressive steps that need to be taken to try and minimize the impact this could have on people's health.
Like what?
Well, there are things that are being done to investigate each of the cases. Right now, what we're seeing is a very different story in Mexico from what we're seeing here in the United States. As you mentioned in your report, we have 8 confirmed cases here in the United States. 7 of those were quite mild disease. 1 of those, the individual was hospitalized, but all people recovered from that illness. The reports we're hearing from Mexico are of something much more severe. It's critically important that the Mexican government and the international community investigate what's going on in Mexico so that we can understand how much of this may be due to this new flu strain, whether there are other factors involved in terms of why they're seeing more severe disease. And we're very pleased that we have some CDC scientists there assisting the Mexican government, the Pan American Health Organization, and the World Health Organization in that investigation.
We reported about 75 students at a New York City school have reported flu-like symptoms. I know that they're being tested right now to see if this could possibly be that similar strain. Can we expect to see cases like this popping up here in the States now that most scientists believe that this particular strain is now being spread human to human?
You know, it's not unusual to see clusters of respiratory disease throughout the year. We're at the end of our flu season, but there are always respiratory viruses circulating, so it's expected that we'll see clusters. What it's very important we do now is investigate each of these clusters very aggressively to determine whether or not any of them could be caused from this virus.
Dr. Besser, I just wanted to ask you real quickly before we leave, just how concerned should the average American be about this right now, and what can he or she be doing?
This is a time when people should be looking at the news for information, but should also be looking at their individual preparedness. What have you done to understand where you're going to get your information? What is going on in your community in terms of preparedness? How would you communicate to your family members in the event that there was a public health emergency? Go to the CDC website, you'll get information. If you go to the government website at pandemicflu.gov, you'll also find information. And it's time for people to prepare whether or not this turns into a pandemic.
Mexico, where this outbreak apparently began, the government is canceling hundreds of events and public gatherings in an effort to stem the spread of the virus. NBC's Michelle Kosinski is in Mexico City this evening to bring us the latest from there. Michelle, good evening.
Good evening, Lester. One big unanswered question continues to be why the cases here have been so severe, why so many deaths among otherwise healthy young adults. And it is impossible not to see the effects of this on people here, the uncharacteristically quiet capital. Today there are 24 more suspected cases, and the government says it might start isolating patients or even inspecting homes or luggage if necessary.
On the streets of Mexico City, in its public squares and subways, the army with gloved hands gave away surgical masks.
Gracias.
After many pharmacies ran out of them. Parents guard their children and themselves. This couple took a protected stroll, wary of what they can't see, an airborne flu that has somehow infected possibly 1,000 people here and killed up to 68. Mexico's president says the capital is facing an emergency situation. Schools are closed, so are public places like museums and theaters. Public events canceled for at least 10 days. The busy boulevards, usually choked with traffic, are strangely free.
The influenza started days ago. There are hospitals already under quarantine. The government knew this, and I think they should have told us days ago.
The mood is worried, though not panicked.
There's a lot of people that are actually really stressed about this. No one really knows in the general population how this is transmitted.
Sebastian Garcia is carrying hand sanitizer, but still out sightseeing after his conference on health care was canceled.
Many people have been trying to avoid large crowds, but in a city of 22 million, that's not easy to do. More and more, though, you do see them diligently wearing the face masks.
Marta Martinez says it's been hard for children who don't understand, but her baby son has gotten used to it. And at busy outdoor cafes, people are breathing in the springtime air, unmasked, though unsure what El Gripe, the flu, will bring upon their city. At this point, to many, simple caution feels right.
Positive news to some is that there have been no more deaths in the last 24 hours, and that patients here also seem to be responding well to common antiviral drugs like Tamiflu and Relenza, of which the Mexican government has 1 million doses ready. Lester.
Michelle Kaczynski in Mexico City, we thank you.
I'm here to inform everybody that based on lab test results that we've had and interviews that Public Health has conducted, it has come to our attention that we have more cases of swine flu, influenza, in this community, particularly associated with one particular school, high school, in the Schertz Cibolo Universal City Independent School District. That's the Byron Steele High School, located right outside of Schertz and Cibolo. The persons who have become ill, we had initially 2 that thankfully have recovered and are doing well, as are their family members. But we have also learned of a 3rd case that is a probable case also of swine flu. At this point, the thing that these persons all had in common was the location of the school. It has been determined in conjunction with the Commissioner of Health of Texas, Dr. David Lakey, and myself as a local health authority, that is in the best interest of the citizens and the residents, and especially of the students and the staff associated with this high school, that we temporarily close the school. The school will be closed for a minimum of a week, effective immediately. We are hoping that this will be able to control this cluster of events that we are seeing right now in our community. We want to make sure that we have taken all steps we can in order to protect the safety and well-being of everyone of Guadalupe County and, of course, the surrounding counties and the state of Texas.